have and not need, and need not have.
Okay. All right, session 9. Behavior change or behavior reduction procedures. Here we go. Training program is based on registered behavior technician task list and is designed to meet the 40-hour training requirement for the RBT credential. The program is offered independent of the BACB. They are not going to take any credit. Okay, so we're not going to review session 8. That is one-on-one because nobody has done it yet. Come on, guys. Do with it. Sorry. It's my fault. I forgot to send it to some people. I don't think I got it. Okay. Components of a written behavior reduction plan. Oh, how much am I make up that? I did not make copies of these for everybody. It depends on where you work on what's part of the behavior intervention plan. I made this for Jen using this type of format, and it didn't work for our setting. It was too detailed. So it had, the antecedents were in a big chunk, and then behaviors, and if this, then that, and it was not what she was looking for. So we ended up using just a one sheet, kind of like an if this happens, then do this. And that way it was a quick glance. Nobody had to read anything too detailed. It was easy to post. And so we did that. It took about 5 different modifications to finally get what we needed for our situation. But the components are your antecedent, what's usually the trigger for the behavior itself, what you're looking for. So is it, and defining it specifically, what type of aggression is it? What does hitting look like? So we need examples and non-examples. Because a hitting might, it's not just any contact, it's force. So with intent to injure somebody else, or when they are frustrated. It's not just a contact. And a bite it could be a mouth, just a mouth on skin, or it's teeth, or it's actually breaking skin, because there are so many different levels of a bite. You have to specifically say what it is that you're looking for specifically, and then what to do when this behavior occurs. Okay, parental consent. Why do you think it's important to have parental consent for a behavior plan?
Because you don't want to, anything you do, to correct it, or, what happens after that is, kind of contact with the child, so, you want...
Right, it can be contact with the child.
It.
So we've had one parental meeting for behavior plans, because we wanted to clarify what our wording meant with this child. Because we were having communication issues with the parent and then what we were doing, and so we had a meeting to say our verbiage in ABA for timeout is not necessarily what your word means for timeout. Your timeout means go to your room. Our timeout doesn't necessarily mean that. We're not using the word timeout. I don't use that word. We use ignore. It's the same thing. My mom didn't send me to my room or hit me. She ignored me. It was the same consequence as if you were getting sent to your room, except I got to play, right? If you go into timeout into your room, you pretty much get to play. So the function of the behavior was attention. So if we ignore the child, you're getting a better result because they are not getting your attention. So we had a parental meeting. We laid out what it was specifically, what the behaviors were, which was kind of a shock to this parent. They didn't understand. They did not realize that the behaviors were to this extreme. So once we explained why we have this behavior plan and what the consequences are, they were on the same page, and then follow through is more likely to occur. And it also is, it's also guaranteed, like it's required through HIPAA too, to make sure that we're keeping this information confidential. Nobody else is going to, know this. You need to know what's going on with your child's life. We're talking about behavior. You can control someone to do a lot of things, and we want them to understand we're not doing this to hurt your child in any way. They need to know what is going on. A doctor can't just give a child medicine without the parents' knowledge. So we have to make sure that what we're doing is allowed by the parents as well. Because if they don't like what we're doing, then we either need to find a different way or we need to part ways. Bottom line. But they have to know what's going on. So the consent for a functional behavior assessment, it goes through the reasons of why. So is it task refusal? Is it property damage? Are they throwing things? Are they physically harming themselves or others? Are they running away from the classroom? So we tell them what our main concern is, what's going on. And then we go through the process of the FBA. I don't know if you guys can see it very well. I don't know how to make it any bigger. Oh, wait. No, never mind. So we go through their medical records. I go through their diagnosis records when they go down to Rainbow Babies and they have their 3-day eval. I read through those and I see what's going on. I see what happened during their labor, what happened. I read everything about this child and I try and figure out inside and out any kind of trigger. So I go through those. I go through their speech evals, their occupational evals. I talk to anybody that comes in contact with them. And then I observe them. So they understand I've already done my part, my homework. I'm not just giving this behavior treatment plan because I think that this is going to work. I've really done my homework and I've researched this child and their behavior, their function of behavior matches up to these research-based studies of these programs work. So I'm not just going to pull it out of my butt. Okay. Okay, so we'll overview of all the components of behavior reduction plan or the functional assessment report. Okay, so the definition of the target behavior, remember it has to be observable and measurable. We have to make sure it's very specific, and off-task behavior has to be defined because Brett's writing, and she looks like she's on task, but I don't know. She could be drawing. She's an artist, right? So we don't know what an off-task behavior looks like. Definition of the replacement behavior. Specifically, what are we going to do to make sure that she's actually being on task? What is that behavior? She doesn't pay attention, right? She's never doing her work. Well, we want her to show this behavior of following along and participating. That's our replacement behavior, the specific definition of what it looks like and what it does not. Measurable objectives. So for IEPs, for example, or whatever, nobody knows this kid. This is one of the assessments I did last week. The measurable objective. Billy Bob will follow simple commands with 80% accuracy for 5 consecutive days across 2 people. So it's measurable. He needs to follow this command 80% of the time for 5 days in a row.
For like a specific amount of time.
It's a specific criteria, specific amount of time, and across 2 people. Why do you think I put across 2 people for most of my goals?
Because if they get used to one person, or if there's like different teaching ways or
right.
ways like that.
So a lot of the times what we see is that's why a lot of them, our kids, have 2 different people. there's lots of different reasons. For example, we have our kid who does really well with one therapist but not so good with another. Well, that does not mean he's mastered the goal. He's not. He's working for one person. It's not going to do him any good in the future. 2, there's different teaching styles. 3, one person might not be taking the data correctly. Different ways of taking data. So just because it looks like they're doing great with this one person and they've mastered their goal, well, maybe they haven't. Maybe that person just isn't taking data correctly. Because I'm telling you right now, I'm looking over data on some of these kids, and there's mastery with one specific therapist, and there's 20% success rate with a different therapist. So my job now is, after I look at these and I go, okay, well, we're never going to master this because clearly communication isn't going on. I need to sit with both people and think, how are you taking data? What's your criteria? What are you doing? Are you introducing different materials, or are you taking it every time? What's going on? Because something is, you can't tell who's right and who's wrong if that's even the case, because maybe they really did master it and the other person's just being harder, or maybe they didn't master it and the person's like, oh, they got this. So it's really important to have at least 2 people that they're mastering this with, because you don't know which one is accurate. The baseline for the target behavior, that's your missing word, baseline. I need to know where they're starting from. How long can somebody literally sit still at their table and engage in work? Most of our kids are less than a minute at baseline. They just are less than a minute. They maybe 30 seconds. Some of our kids are literally starting at 30 seconds of sitting and focusing for 30 seconds. One of our kids mastered that this week. Got 30 seconds done across for 5 days. And I think our criteria for this one was 3 days across 2 people. So now we're on to 1 minute. Little baby steps. That's the baseline.
So what's the baseline? It's like this.
The baseline is where you're starting before any intervention.
Okay.
What they're coming to you with. Then the summary of the FBA and the preference assessment. So the FBA is what I do. I do the assessment. I interview the parents. I give them some rating scales. I compose this 19-page document to give into the insurance companies. That's my FBA. I do observations. I take behavior data. I give it to them. The preference assessment is something that is one of my weak points. I forget to do that as often as I should. It should be done at least once a month, is doing a preference assessment, especially the kids that change their desire, their wishes, their higher reinforcers frequently. Some kids change it so fast, and we think that they like this, like they like dinosaurs the best. Well, maybe they like it, or maybe like with yours.
Yeah.
Right. So yesterday you weren't here, and so Dina covered for you. Well, she pulls out trains. That's not a high preferred anymore, and we know that. But she doesn't know, right? Because she's never worked with him. But she knows that when he started, that was a preferred. So luckily I was in there and I pulled out the phone letters. And he's like, yeah, I'm all for the letters. So he changed his preference. He doesn't care about trains anymore. He doesn't care about the vegetables with Nikki. And his preferences are changing.
Yeah.
But why? But do you know why he doesn't care about the trains and vegetables? You've taken them away. Like they are highly preferred. Like we took those away. He has to really work for them. So now, if he has to work for it,
yeah, he doesn't want them.
Because that's too much work. I don't want him anymore.
See, and then what do you like? Okay, so then like with anything like that, though,
that's why you have to keep doing preference assessments, because that's what's going to happen. He doesn't like his ice pops anymore. Right? They're not highly preferred anymore. So they change, and that's a hard part of our job, is because we have to find something that he will work for. So right now it's those letters. So now you're going to use those letters only after he's done working.
Right.
So, but we needed him to disconnect from mom.
Yeah.
I have a question.
Yeah.
So how would you restate that? Like, simply.
Preference assessment, we need to find out what they're willing to work for.
Okay.
And we need to do it at least once a month. There are different apps that we can use on the iPad.
Mm-hmm.
We can pull out their 5 top favorites that we know they like.
He really likes the firework thing on her
Mhm.
iPad too. Like
Loves it.
once you give it to him, he
Right.
doesn't want you to take
So
it
right
away
now
from
that's
him.
our highly preferred. So we won't pull that out until after he's done some
With everything.
long,
Yeah.
like at the end of the day, like
Yeah.
after you have to work for a
Yeah,
long
because
time.
a lot of times I can get everything done with at least like 20 minutes left, and then
Mhm.
you could, you know what I mean? Like,
Yeah, and then he can have it at the end. So there's several different preference assessments. I think that was the one that you did go, because that was, I think that was like the first session. Their preference assessments, wasn't it? Like the third session or something. That was okay.
I
Now
have-
we are going to continue.
Wait,
session 9.
I have a question.
Yeah.
So I got all that about the what the preference assessment. That makes sense. But how would you state it as like our student that we were referring to? He's lost that preference. Like he hasn't lost it, but it's like not high.
It's a low preference.
It's a low
Because he has to
preference
work
now
for it.
because he has to work for it. Is there a term for that? Like shift in
No,
the.
he just moved on.
He just
There's
moved
not
on.
really a. You would think in the ABA world they would think of.
I would think there'd be a term for that.
I don't. Huh?
Extinction, and there's
Well,
or is that like
no, because
extinction?
extinction is when you're getting rid of the behavior.
Oh.
He's just,
License.
which is good. I mean, it's not a bad thing.
Well, 'cause
That's
he used
all.
to.
That's all he did.
Yeah.
But,
He
like, now his
only
behavior-
literally would walk around the house and chew his trains all day long.
Well, like, and he never, like, now he's starting to, like, not work. You know what I mean? Like, before, like, I could get him to
Right.
do things,
So
and now he's like, mm-mm.
Would, I
having
mean,
his
and it's
personality is coming
bittersweet. It really is. He's starting to understand the first then concept, and he's growing. Basically, it's our spontaneous recovery, I guess. Your extinction burst. It could be any of those things, but for his preference, it's a good thing because he doesn't want just trains. He doesn't want just vegetables. He wants other things now, and that's a good thing. Now the hard part is what else? Who knows? What else is out there? Because we'd never thought foam letters would be the thing, right?
Yeah.
We know marbles, but marbles are too dangerous, I think, right now.
Yeah,
Until he
especially
stops
because
mouthing everything, I'm not comfortable giving him marbles.
And, like, now he doesn't even want his chew thing, though. Like, I go to give it to him, he'll
Yeah.
chew on it, and then just toss it across
But
the
has he
room.
put anything? Is he really putting
Yes.
anything in his mouth?
Yes. I mean, he will shove the train all the way in his mouth. But then I replace it, you
Yeah.
know what I mean, with the chew toy, and
Yeah.
he'll chew it for like 2 seconds, and then he'll toss it, and then put the other thing back in his mouth. Like, he doesn't even want the chew anymore. I don't know.
Mm-mm.
And
I don't
one of
know.
our other kids
And the
picked
sad
it
part
up.
is I don't have
Gosh.
any supervision hours with him right now. So I can't even dedicate as much time as I need with him.
Well, I mean, and that's fine, because he's not one that, I mean, you know what I mean? Like, I'm
But
okay.
he
it's-
is. He needs something.
Yeah, yeah.
We'll figure it out. Okay. So example of the FBA report. Okay, I think some of you, Barry, I know you have it for sure, probably have seen it before. Maybe some of you guys, I don't know. Did I give this to you guys last time? An example of the functional behavior report. This is their example. Let me see if I have enough copies. I don't know if I do.
Yeah, I got one. No, maybe not.
Ooh, I just might.
Oh, I do have one.
You do?
Yeah.
I don't think so.
I don't.
Look and see if you have its functional
Wait.
behavior assessment report.
Yeah.
I don't think I have.
From what?
It's functional
I think we got it
behavior.
last
Oh, we did?
thing.
Maybe.
think
If
I
you
have
didn't, she might have gotten it for one
Yeah,
or
I
three.
might have gotten it from you.
I don't know.
So much paper.
This?
Yes.
Okay,
I think
that's
Mary
it.
has it. Do you have it? I
I
don't have it. There's one. There's one. I'll give you an
Thanks.
extra one just so. Here you go.
don't.
I have extras. Okay, so this is the example. So the reason for
Oh.
referral. So they defined the self-injurious behavior, physical aggression, property destruction, and elopements. And then you have all the medical background part of it. And any kind of medication that they're on is usually on there. Yep. Current medication and the dosage and why, which is important for us, especially like we've seen it with one of our kids. Something's going on with medication. We don't know if he's on it or off it, if that was a trigger, if it's not a trigger. I talked to one of our staff today that knows him. There's nothing else going on at home that she's aware of. Cannot figure it out. So it's just going to take a lot more watching and observing to see what's going on with him. I'm not sure. Then the health summary. Then you have observations when they took place. There's the preference assessments, the results. So they just did pre-operant, which is they just watched him in his typical classroom or home to see what he liked to play with and how long they each was playing with. Then you have the target behavior operationally defined, so specifically what it looks like, because you have to be able to define it to say, yep, that's what it was. You know, he's throwing his body against the wall. And how much intensity, what the function of the behavior was, the replacement behavior, then you have some graphs, blah, 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 the baseline, and then your recommendations, how we're going to change this behavior. Service outcomes, so this is pretty much like, it's very similar to my report. So my report is, it's just labeled a little bit differently. So this one has the family dynamics, family considerations, the medical. Why is it not highlighted? Oh my. Okay. Medical, and then his VB map scores. And then all those scores. The goals, and then the end, we have the behavior frequencies, what they look like, how often they occur, the preference assessments in there, and then the outcomes. And they are like eat firm foods, stand still when needed without fidgeting, participate in organized programs, and then now they are making us put in parent training programs because insurance is paying for it, so they want parents to be involved. So I have to train parents too.
Oh, you just do everything.
She does.
Yeah. Yep. Transition plans and the discharge plan. So that's part of our FBA process that we have. It's fun time. So it does have the medication in there and everything. Okay. Voila. Moving on. Method for data collection. We talked about this last week. So we have, we can take direct or indirect, so we can count their frequency. We can measure how long it takes, how long their behavior happens, or the latency. So if we give the direction, how long does it take before they actually clean up? If we say it's time to clean up with our one verbal prompt, how long does it take, if ever, do they clean up? If they're not cleaning up on that one verbal, we're not repeating ourselves. We are not a record. We're just going to say it one time. We gestural, we guide them one time. That's it. Don't make this job more tiresome than it already is. It's an exhausting job. You don't need to keep repeating yourself. Please stop repeating yourself, is what I'm saying. Say something one time to the child. If they don't, get their attention by bringing them, pointing. That's it. Treatment times and locations. So on an IEP PAL, we put what time it is and the location when we take the data. I guess this is on the FBA, but we'll put it's all either here or in their home or at their daycare. But a lot of our new kids that are coming, they want everywhere. They want it at their home, they want it at the school, and they want it here, which is fine, which is good. I just have to see how to do that. Get everybody's hours. So hours are coming for those that want them.
Yes.
They are coming. Functionally equivalent replacement behavior. So why are they doing it? Are they doing it for attention? Okay, then we're going to overload them with attention on everything else that they're doing except for that one behavior. So if they are throwing themselves on the floor or headbutting or biting because they're doing it for attention, we're not going to say a word. That's giving them attention. They win. We're not letting a 4-year-old win at all. We're going to stop talking. We're not going to look at them. We're not going to let them hurt us, right? We block. You can block and see out of your peripheral. You can look away. You can talk to another adult. You can pretend you're on your phone. Do what you need to do, except talk to that child and look at them, because your poker face isn't going to work until you have had a lot of practice. No
Sometimes
looking.
that gets really difficult when
It-
you're like especially-
You have a hard time with your poker face. No looking. We're not looking. No reaction. It hurts. I get it. I know it hurts. You think when I get smacked in the face or headbutted, it doesn't hurt me? It hurts. It's like an instant headache. But they don't need to know that. It's not their fault. They don't know what they're doing. They don't know how to tell you that something is bothering them. They are not doing it because they hate you. I promise they're not doing it. They're frustrated. So don't look. Don't pay attention to that behavior. I'm not saying don't pay attention to the child. You're looking away. You're blocking so you don't get hurt. Probably should stand up, because if you're down on their level, if you're working close to them and you know that that person is a good hitter and they're quick, you probably want to not be so close.
Right.
How about give some distance? You're in control of your environment. You're in control of your table, of what's out on you, in front of you, around you. You can sit with them. You can stand and lean over. You can stand over them. They can't hit you if you're not in hitting distance. So you have to be aware of where your body is. Don't put yourself, if you met a stranger on the street, you wouldn't get that close to them, right? Because you don't know if they're going to flip out on you. That's kind of like what our kids are. They're ticking time bombs.
Cute ticking time bombs.
They really are. And it's a good thing that they're adorable.
Mm-hmm.
Because,
Yes.
man, oh man. Reinforcement schedule. So we have token boards for some of our kids. Some of them don't need token boards, but even if they have token boards, how often are you giving them a token? Or under what conditions? The letters NCR are non-contingent reinforcement. So you want to reinforce all the time if they're not doing that behavior, right? It's non-contingent. Any time of the day they want attention, that's great. That's probably, my favorite. But then you have, if you think of slot machines, those intervals, like eventually you're going to win, right? Eventually, you just don't know when. So it's not a certain amount, it's a variable amount of time that's going to go off. Those have been studied. There's a reason why people play slot machines. It has been researched and studied, these variable intervals, right? Around 20 minutes maybe, you'll get a reinforcer. Or for our kids, around 3 minutes. Or around 3 responses. Somewhere around there, we'll give them a reinforcer or a token, so it's not always set in stone. If it's variable and they don't know specifically, they're going to stay focused more because they don't know exactly when they're going to get it, but they know about. And once they get that reinforcer, they're going to chill out for a minute. They're not going to work as hard. Right? They just got a reinforcer. Why are they going to bother working? But then they know, wait a second, I do kind of want some more. It'll come back around. So it's like a step. And I really thought one of my posters had that on there. I couldn't find it on there. That's why I brought my posters.
I didn't say that.
Try to see if it's on here. I had pretty much the different types of reinforcers memorized. This was for the third time I took my exam, where I had made these posters and put them. These were the harder ones that I didn't really. I couldn't really grasp.
So with this
line graphs.
non-contingent reinforcement schedule, right? It's random.
Mm-hmm. Yep, as long as it's not that behavior.
As long as it's not that behavior.
I can find a good picture of what it looks like.
So when I just randomly give my dog treats,
Yeah.
that's because he's not being a turd.
Right.
Yeah, okay, thank you.
There's a
thought
reason
so.
for it.
That's right, husband.
Right. You tell him you're doing ABA with him.
I've tried to tell him that.
Here, I'll draw it. I'll draw it on the board. Wonder if it's, hold on. There's a million places that this could be. 39. I used to know this book.
You probably blocked it out.
Probably did.
PTSD.
Man, it's kind of important. That way you guys can draw it. I'm gonna find it, don't worry. Okay, 310. Okay.
To tell you. 'Cause I can't.
Okay. Don't hurt your. Just draw on this board.
I don't know how to say it.
You don't do me.
No.
Oh.
Yes, everyone. No.
Okay.
In general, that's how I am. No.
Okay, so we have fixed and interval.
So
So,
this is for
this is
the
random.
reinforcement schedule.
yeah. Okay, so we have random and then a specific. Whoa. Okay, and then you have interval, which is time. And then you have ratio, which is the, I guess, action. What the kid does, the behavior. Yes, I don't know. Okay, so the first one I'll do is F, which is fixed, R. So you have a fixed. I'm sorry, I only have one color marker. Oh wait, I don't. Hold on. Because these are definitely two different things. Okay, so here is, you either have an F or an I, and then you have, and then you have an I. I did interval twice. I didn't even catch that.
Yeah, I did. I just
did
thought
that.
it was.
That's what I thought.
You guys are so funny. Where's the tissue?
I just thought it was
Can
both.
you give me that tissue?
Oh, jeez.
This is not, this is variable, sorry.
Variable. And the BX is behavior, right?
Yeah. Okay, so we have F, fixed, R, is your fixed ratio. Okay. Real. Okay, so it's a fixed time with its ratio. So what happens is after every 5 minutes, they get a reward, and then there's nothing. They don't do anything. Then 5 minutes later, they're gonna hurry up and work, and they're gonna get a reward. And then they don't do anything. And then they're gonna hurry up and get something because they know there's gonna be a reward.
They like have the craziest time clocks in their head, like they know exactly when
It's
things
crazy.
are supposed to be going.
Then they don't do anything, and then they know, boop, I better hurry up because it's timer's coming. Right? So then we have the VR, which is variable. So it's just a random time, a random amount. Why do I keep doing that? Okay. So it's a random amount of behavior. It's a steady incline. They will continue to work. I'm gonna keep doing this slot because it's gonna come. It's gonna come. We don't. Eventually, so maybe every 15 polls. So between 10 and 20, right? We say a variable ratio of 15. So anywhere between 10 and 20 polls, they're gonna get reinforced. They're gonna get some kind of money. A study. It's proven. That's why slot machines make so much money for casinos. And it astounds me. I went last weekend. Like, it astounds me that they're filled. You're not going to win. You're not.
But there's always hope.
I mean, if you're that lucky one.
Somebody win, right. You win once.
But that's like the lottery.
You know how much money you have to put in? It's exactly like the lottery, right? So then we
I
have
love
F,
the lottery. I get all your tickets all the time.
fixed interval.
And everyone with $2.
Oh, these are
but
minutes. These are responses.
Oh.
Here.
I get excited when I get my
They did it
deal
backwards.
with it.
I'm gonna confuse you guys more than anything.
Yeah, you are.
Fixed interval, this is the time. If you see what I'm saying, it doesn't make sense, then tell me.
Number of responses.
They call this a scallop. So on your exam, when you take it, if they say, which one's the scallop? It's fixed interval. Fixed. So 5 minutes, 10 minutes. So they'll kind of work. This is the behavior. This is out of so many responses they know. And they have just, these are like their breaks where
So
they
what's-
don't work.
So what's the little swoop thing?
This is when they get reinforced.
Yeah, but what's in the
So
middle?
this
Like
is,
they're kind of working.
they know it's coming soon.
So they're kind of working.
But here,
They're just consistently working.
Yeah.
And then that one, they're not at all. Okay.
variable. So the variable is always going to be better. It's going to go up, it's just not steep. I'll take a picture of it, yeah. It's supposed to be more straight. It's not of a steep incline, but it does go up. It's just not as far up. So your variable is what we want to focus on when we're reinforcing our kids. They don't have to know how many pictures they have to label. They
So
don't.
how do you know the difference between like variables like that one that's super steep and that one?
Jiminy.
Jiminy.
Variable interval.
Is it in the paper?
I'm gonna take a minute.
And then is it literally just that? Like variable interval would be random time?
So it's
And
not a
then fixed.
random time. So if I say variable interval for me on my exam, I had to label a certain one. So variable interval 3, which meant 3M. I had to be really specific. So that meant around
Every 3 minutes.
every 3 minutes. That could be 2, it could be 4, it could be 3.5, anywhere around 3 minutes is when you're gonna give the.
So smart.
Right, it worked. Blair. So, but our variable ratio.
Sorry.
So we could say a variable ratio of 3. So maybe every 3 responses, maybe every 2 responses. Maybe this picture was really hard and I'm just gonna give you a reinforcer after this 1 because it's around 3. So it's anywhere around. We're not going to wait till they do something 10 times. We're not gonna wait even 7 times because 7 is not close to 3. It is too far away. They need quicker reinforcement, especially in the beginning of ABA. As they get bigger and older and they understand what's going on, we can increase it to have a variable ratio of 10. Maybe what I'll do, hold on a second. Watch your bases. I don't know if that's any good. I don't know how to zoom. I think I can zoom it in.
I'm just gonna cross this out.
I don't know how to zoom it in.
I think there should be a.
But I think you guys can see it pretty well. So you have a fixed variable interval ratio, and then you have FR for fixed ratio, VR for variable ratio, FI fixed interval, VI for variable interval. Okay. Beep. Okay. All right, generalization and maintenance. So we want to make sure that whatever we teach them here, they can go home and do the same thing with Nadine, right, at their house, or whoever else starts going to their homes. And then maintenance, we want to make sure that when they come back from summer break or a spring break, they're still able to do this skill. They're still able to use these coping skills, or they've learned the expectations and how to behave appropriately when they're not here every single day. We want to make sure it's long term, so it's maintenance forever. They're not going to lose that skill. So with Mandy and I, we run maintenance. There's a maintenance on, and hopefully Braintree will have this on our program, where it will give us a choice if we want to work on the current programs or a maintenance program. So yesterday, I ran maintenance before I did anything in Avon. I made sure all the maintenance was there, because if he doesn't get that maintenance check, if he fails it, it's going to go back into his work next week. So we'll focus on it again. And he did really, really well. I think there was only 1 or 2 things he missed on the maintenance, so that it was much better than the first time. So as long as we keep the maintenance checks every week, we know that they didn't lose that skill.
And then if they do you just work on it with them until they
have to remaster it.
They have to remaster it, not just once they get it done, then you.
Mm-mm.
Okay.
Yep. Yep. Just to make sure, and it should, if they remaster it, should only take 3 days.
Right.
3 to 5 days. It'll be a
Once I
quick.
remember it, yeah.
Right. The consequences for the target behavior. That's in the FBA too. So, what is, if they are doing something for attention, if they hit someone, what's the consequence? Nothing. We're not going to tell them no. We're not going to tell them I don't like that. We're not going to tell them, yep, you don't get to do this. Nothing.
Ignore.
The point is they're doing it for attention. So the whole consequence should be, close your mouth, guys. They're going to win. If you say anything, they won. Because there's still, whether it's a good attention or a bad attention, they still got it. Okay. Extinction procedures for target behavior. The extinction is absolutely no reinforcement. None. If everybody's on the board doing the same thing, we will extinguish, we'll get rid of that behavior. Fade, restrictive procedures, is your missing word there. Fade, restrictive. Do you have that? Oh no. Oops. Let me mess yours up. everything else was in order? Oh, I have my readings. Here, this one. Oh, goodness. Okay, paid restrictive procedures. So how are we going to make it not so demanding all the time? We don't want to be harsh all the time, right? We want to make sure we can fade off our strictness and be able to have fun and enjoy learning. So there's a process to that, of how to stop having such a specific way to talk to the kids. Schedule for the behavior plan, criteria for revision. So if they're not making progress over, it's been 2 weeks and we're still not seeing any progress, then we get together and we sit down and we figure out a revision, because it should not take longer than 2 weeks. At
We're at
most.
that point with relaunch.
Yeah, on some of his goals. And now it's like,
I mean, like at a deadline, like not going anywhere, like he's
Mhm.
flatline.
so we have to revise that and see what can we do, what can we do differently. And part of that might be adding another therapist, right? Like, so until we can figure out that part, and how can we change either schedules or wait until he is approved for more hours, because that might just be what he needs. He might just need a change. Like,
Yeah.
he's too complacent.
He already knows what the routine is. And
Right.
He knows.
He knows, so he's done. But if we throw another person in there, or I don't know. Let's see, treatment integrity specified. So when I go in and I'm looking at, and I come in and I'm hanging out with you guys, I'm looking at how it's being implemented, how the treatment's being implemented, and I'm looking at the data and seeing what's going on. So I want to make sure that treatment is being given as diagnosed, basically. Reliability checks, same thing. Is everybody doing the same thing? Is this data reliable? I knew one of them had a couple pages missing. I just didn't know which one was. That should be, yeah, that's the last picture missing. Okay. The functions. So here's your problem behavior. There's there are 4 main functions of behavior: to obtain or get something, attention, tangible activity, or escape and avoid something. Escaping people, escaping pain, escaping work. So you want something or you want to get away from it. Is it a sensory thing? Is it social or tangible activity? Then the social can be an adult or a peer. So obtaining is positive because it's adding on. So remember, it doesn't mean it's good or bad. It just means you're adding it, like a positive number. And then negative, you're taking it away, just like my bank account. It's negative.
I feel it.
And I'm negatively reinforced to go call my mom. Because unfortunately, she's the only one that can help me right now. Motivating, establishing operation. So your motivating operations, or your MOs, and your establishing operations, your EOs, they increase the value of your reinforcer. Okay, so, please, I think I saw this in my posters.
Let's make those into a book.
I'm starting to be really hungry. So these are my alternative schedules. So if you guys ever want to combine those easy ones and make them a little bit more complicated, that's fun. Just kidding.
I'll
multiple.
stay with easy.
No, I was wondering about that, if you can like put
Oh
those
yeah,
together.
look, we got mixed, concurrent, chain, multiple, alternative, conjunctive, tandem. Okay,
Bicycle.
hold on, but one of them had one of those in here. I know it did. Okay, well no. All right, so your motivating operation is your, what are you willing to work for? What is motivating for you? It could be you're hungry. I'm really hungry. So that's my motivating operation, is to go get food. I'm hungry. So the establishing operation is when I call Zeppies, they will bring me food.
In theory.
Eventually. We go through this every time with them, and yet we still go back.
So what are we learning?
Nothing.
It's really funny.
Our behavior is not changing
No.
at all. Okay, a discriminative stimulus. So now that once you guys start seeing this word and these two letters, SD, I'm going to start writing it more because it's way easier for me to write an SD on your, except for Barry. Everybody else has seen these. Our programs, right? Because he has ESAP, so he doesn't have these specific programs. But here it is in our top green corner, SD. That's our direction, basically. It's the action that precedes the reinforcement. The action that precedes the behavior. So it's our SD. So, present the individual with a field of 1, 2, or 3 flashcards of letters. Hand another flashcard that matches one in the field and say, match. That's our direction. That's the SD. That's what we do. Our SD right now is my stomach is growling. Right? So before, that's my SD, my stomach's growling. My learned behavior is I can order food because I didn't bring any.
So like
So that I
establishing is basically like what do you do about
So there's establishing and abolishing, and we'll get to abolishing, I'm sure, coming up.
So
But establishing is something that reinforces your behavior to keep going.
okay.
So the MO is what you're willing to work for.
Yeah.
And
the EO is the reinforcing aspect of it, where
Forces behavior to keep going.
yeah. Oh, there is a video. They can
Oh.
explain it better than me.
Good.
Yay.
So we like to start every morning with something we fondly refer to as the jargon of the day. This is when we take on one word, one phrase, one acronym. We give you the actual definition, and then we make fun of that because usually it's something we can't understand. And then we give you a working definition, which frequently makes the experts break out into hives, but it gives us a platform from which to begin to understand these terms, use them in our lives, and get to the progress that they help us to get to. So today's term is SD. You will hear experts talking about the SD. What's the SD? What's the SD? What does that stand for? Well, that stands for discriminative stimulus. And you'll notice that it's normally, it's an uppercase S and it's an uppercase D, but the uppercase D is smaller, even though the phrase starts with discriminative stimulus. Please don't ask me why that is the scientific notation for it, but it stands for discriminative stimulus. So let's take a look at what our actual definition is first of discriminative stimulus. It is a circumstance, and I'm having to read it off the screen because I'm blind today without my iPad. A circumstance or action that precedes reinforcement. Okay. If we know a little bit about ABA, that might make a certain amount of sense. But I don't know about you. I want to know, what does it look like? So let's go ahead and go to our working definition. and see, our working definition is what you say or do to get the child to do the desired behavior. So we've talked about ABA before, and that ABA is this really all-encompassing teaching method that helps us to get from point A of learning something to get to the point where we say, by George, I think he or she has got it, right? The skill is ours, and we know how to use it in all circumstances and are even able to take in new information about things that we've never been taught before, right? That's the goal when you're teaching anybody anything, right? So what we usually do in ABA is take and chunk whatever this skill is that we're trying to teach into small bites, right? Little itty bitty skills that we can put together to make a big skill, or that we're trying to get it to a small place where we can begin to build the muscle to be able to do something, right? Because sometimes it requires one or the other. But and then we want to make it so that the person is successful at each different goalpost that they're trying to learn this. So for instance, if what I wanted to do is to teach someone to say their name, and let's say their name was Rebecca, right? I might start with trying to just get them to say "ruh," and then I would get them to say "buh." I've got Lux blocks flying in on me. And then I might teach them just the beginning syllable, "ruh," right? To get them to make that sound. And then I would give them reinforcement. Okay, whatever I do, now I need you to stop though. You're building towers and they're trembling. This is what parenting is all about, right? But in any case, so we want to make it reinforcing for the individual to keep doing it, because otherwise, who wants to keep doing something that they don't have perfectly, right? You want to get something for having done something. You want your paycheck, right? So that's the reinforcement. So the SD is whatever we do or say that signals to the person, if you do this, then I'm going to give you a reinforcer. It's a way of setting up a teaching moment, and it starts with an SD. And the SD can be anything. It can be words, it can be a gesture, it can be showing something to somebody, but you're setting up the circumstances to say, hey, this is a learning moment. And by the way, because it's a learning moment, if you get it right, you're going to get a paycheck for it. And the paycheck is individual to the person. The SD is individual to the person and to the task and where you are in the task. So it may be that I've got a little girl that I'm trying to teach her to say Rebecca, right? And the first thing that I'm going to do is teach her to do the R sound, right? So my SD might be me pointing to my own lips and going R, right? That could be the SD. Or it could be me holding up a card that has the letter R on it. It could be that I point to her lips, right? It's going to be different, but the SD is whatever we say or do to get the desired response that leads to the reinforcement. So you can see SDs are wide and varied, but when you hear your therapist talking about, and they'll say, well, we're teaching this lesson, and somebody says, what's the SD? Then you know it's whatever the thing is that starts the lesson. It's what you say or do or point to that precedes them doing the action, and then they get the reinforcement. If you think about it, when we talk about the ABCs of behavior, we talk about that there's an antecedent, a behavior, and a consequence. Well, the antecedent is the SD. It's the thing that happened first, then we got the behavior, and then the consequence when we're teaching is the reinforcement. So the SD comes first, they do the behavior, and then hopefully if they got it right, they get a reinforcement that means something to them. So the SD, the thing you say or do to get that, and this is the way we begin to teach. It is not the be-all, end-all. There are many things along the way, but when you're trying to teach, am I keeping you awake? He's over here yawning. When you begin to teach somebody, this is a really easy way to get someone to want to learn. Is by using that SD, getting the behavior, and giving the reinforcement. It's more effective than any other teaching method. And it happens to work for our kids on the autism spectrum. But by the way, it works for everyone.
It's Grease.
What does reinforcement look like? It is the presentation of something desired, which is positive reinforcement because it's the presentation. Or the removal of something undesired, which is negative reinforcement. So, work, pain, hunger. This pizza negatively reinforced my behavior of calling Mazeppi's. Right? Took away my hunger. Or it is the presentation of the pizza,
Made you work.
which would be a positive reinforcement. So it all depends on the situation, how you're looking at it.
Always.
Typically. Never say always.
Never say never. Never say either of those.
Nope. There's always an exception. So positive doesn't mean good, and negative doesn't mean bad. Positive is presenting, negative is removing. So it's an attempt to increase or maintain behavior, because reinforcement increases the behavior. Always. Always. Reinforcement always increases the behavior. If you give them attention, it will increase the behavior function. The function of the behavior for getting attention. Differential reinforcement is the reinforcement of one form of behavior and not another. Like replacement behavior. You're not going to scream when you don't like something. You're going to say, no thanks. You're not going to hit when you need some space. You're going to ask for a break. It's your replacement behavior, and then they're reinforced when they act appropriately.
Hello, my name is Tiffany Otero, and today we will demonstrate the differential reinforcement strategy. This intervention is useful when trying to reduce a problem behavior and encourage a desired behavior by selectively reinforcing the desired behavior. This intervention has substantial support in the literature, particularly in the area of applied behavior analysis. The primary benefit to this intervention is its flexibility. It can be used with a variety of students in a variety of settings. Today we'll see how Mrs. Nante uses this with one of the students in her class.
All right, we're going to do some math problems. We're going to do some addition and subtraction problems. Okay? We're going to start with the first one, 975 minus 26. Dylan, what do I need to do?
I don't want to do it.
We have to do it, Dylan. What do I do?
I don't want to do it.
Okay, if you're not going to participate, then you need to come remove your animal from the forest. Yeah. Okay, are you ready? Okay, Dylan, you keep reading. I'm going to go work with Sally over here, okay? Dylan, stop. Okay, class, we're going to review our spelling words.
Hey, give me.
They're homophones
Just me.
this week.
Just me. Wait, me.
Okay, can you stop interrupting, Dylan? Okay, Dylan, so I want to talk to you about getting my attention. Instead of yelling out and making noises, what could you do if you need me for something? What do you think you should do?
Raise your hand.
Okay, raise your hand. Can you show me how to raise your hand? Okay, so after you raise your hand, What do I need to do before you ask me something? I need to
Answer. Calling you.
call on you, right? Okay. What if I'm busy with another student and you have a question or you need something?
Ask a neighbor or a friend.
Okay, you could ask a friend. But let's say no one knew what to do.
Mhm.
What could you do?
And wait patiently.
Sit and wait patiently, right? Because eventually I'm going to get to you, right? Okay. Sounds like a much better idea to me, right? Okay, good. Okay, Dylan, so if I see you doing these things, raising your hand and sitting and waiting patiently for me, then I'm going to give you a piece of paper so you can put your name in the bucket, okay? And then what normally happens if you get to put your name in the bucket?
On Friday, you if you get drawn, you get a prize.
Right, so you might get your name drawn out for a special activity or a prize. And why do you think you want to get your name in the bucket a lot of times?
Because I'm telling you, I'm being good.
Right, you're doing the right thing. And also, right, the more names you have in the bucket, the better chance you have for your name to be pulled out, right? So you want in there a lot of times, right? So keep doing those things, raising your hand and being patient, waiting for me to call on you, and then you can hopefully get your name in the bucket a lot of times, okay? All right. Okay, I want you to keep working, and if you need me, then raise your hand and I'll come help you, okay? Just keep working hard. Great job, Dylan.
A snack for later. Then he'll need
Yes, Dylan?
what's this word?
That word is notebook.
And some pencils. He'll
Good job, thank you for raising your hand.
want to share your backpack too.
Thank you for being patient. What do you need?
Turn this in.
You're just turning this in? Okay, thank you.
Reinforcement practices, environmental enhancement or modification. So you're establishing operation. So it's a change in the environment that alters the rate of responding. So this pizza, it's our change in the environment. That's our establishing operation. It helped our MO of being hungry.
Do you want more than one?
The example they give: during the night, Megan experienced 3 occurrences of wakefulness, which interrupted her duration of sleep time. Trying to think of the environment that alters the rate of responding. So, the change in the environment. I don't know, maybe there was something that kept waking her up. That's a really bad example.
How is that an example? I don't understand.
Something must have woken her up.
Husband snoring,
Yeah. Maybe the dog farted something.
and there was
Maybe she had a bad dream.
yeah.
So 3 occurrences of wakefulness which interrupted her duration. So she didn't sleep for a full 7 hours.
I don't understand. Okay.
Sometimes I don't ask.
Just move on.
I didn't make it.
That's why I need my phone.
Oh wait,
Wait, go back.
I am gonna go back. I missed that one. Okay. Reinforcement practices. Social approval. Provide attention to an individual following appropriate behavior through verbal praise, gesture, or a facial expression. So a parent gives a thumbs up to a child when they use a tissue to wipe their nose. You'd say, nice job, nice working, nice quiet hands, or I like the way you walked in the hallway, I like the way you shared your cake yesterday. Lexi, one of our kids shared his cape and mask with Ariana. She wore it all day.
I have.
That's so cute.
It's really cute.
And the mask
Like, I
was
feel
like,
like
we're
Ariana
She
good.
cannot keep it straight on her face.
I feel like she's doing very good playing with other kids now. Like she's like expanding her kids that she plays with.
She just did a reval. It was really good.
She wouldn't
That's
play with me
awesome.
yesterday. She wanted Marina.
It was really
Really?
good. Reinforcement practices. Role playing. So performance of a sequence or of responses to simulate the action of an individual under other circumstances. So, the example, an SLP, so a speech therapist, would like a parent to learn how to use a symbolic picture system, which is our PECs that we use, our pictures for communication, to teach a child to communicate. So, the speech therapist pretends to be the parent, and the parent pretends to be the child, as the speech therapist shows the parent how to create opportunities for the child to use the symbols, and then how to prompt the child to use the symbols. So it's similar to how I teach you guys, right? I put you in the situation. Like, this is, you acted out. Like, I want you to not listen to me and cry and throw and hit. And then watch how I'm going to handle it, or how I can give the consequence or ignore. Not necessarily do they want to, this is different because it's SLP, so they're just teaching the child how to use the communication, so the child doesn't know how yet. So the therapist can't use the kid the entire time for the role play. But once you're practicing it yourself, you understand it a little bit more in role play. I don't like doing role play with other adults in training programs.
No, it's weird.
It just makes me uncomfortable. I must have some kind of trauma with it. I don't know. Reinforcement practices makes me very uncomfortable. Modeling and imitation. So when a person demonstrates specific behavioral responses to an individual and they repeat the responses shown. So I try and model how to block. I try to model how to present the materials for you guys to work on. It just takes practice. So, but once you see how it's done, then you can perform that action easier once you actually see it. It's easier to do when you see it rather than just hear it or read it. So an adult walking with a child who has autism passes another child in the hall, and the adult says, "Hello," and then visually prompts the child to say hello. So we are acting as examples to our kids. My turn, your turn, whose turn? Yeah, it's good. Miss Reno's.
Oh my gosh.
Reinforcement practices. Okay, so prompting or errorless teaching. So there's no room for errors. We want to make sure that they are successful with every turn. Even if we have to prompt, they're going to do it again. Even if we have to hold their hand, they're going to get it right. They're going to perform the action correctly. We don't want them to practice the wrong thing. So we're giving them hints or cues that precede a desired behavior that are not related to the desired task. So there are many types of prompts. We have gestural, visual, verbal. Pausing, so that's like your wait time. You're just waiting, giving them a processing time. Partial, physical, and positional cues. They put modeling. I use modeling a lot. So I'll show them and then they do it. So that way they see how to do it correctly. And the second it looks like they're going to complete that task incorrectly, we prompt them so it's done correctly. Because tying your shoes or washing your hands, we don't want them to miss a step because then they're going to practice it wrong.
What's positional?
So you're going to move the one so they get the answer wrong, right? There's 3 different pictures and you say match and they get it wrong. I'm going to maybe move the correct card a little closer to them.
Yeah.
Or I'm going to take the incorrect one away. Now they only have 2 choices, so you're moving around the position of the actual correct item is changing.
Or like for like when I do that with Rianch, like when sometimes he'll only put it on the right side or
Right.
like only
So
outside. So then would I just put the right answer always like
Yeah.
on that side that he's
Yeah, so you're going to change it up. Maybe you put them, line them up top to bottom instead
Yeah,
of
I've done
doing
that up and
horizontally, do
down,
it
yeah.
vertically. Because then
Yeah.
there is no right side.
yeah
Can't
I've
do
done
it.
that
He has
too.
to really look
Yeah,
because they're all on right or all, so
yeah, I've done that one too.
it's changing the position of it. Fading prompts and cues. So we don't want them to get prompt dependent. We don't want them to always look at us and they do. They grab your hand and they want you to write for them because it's easier. So, but we want them to do it correctly, but we need to fade out our prompts. We're not going to be there forever. It's like with me. I had to fade myself out of all of you guys because you can't get too dependent on me. You're not going to learn if I'm always there. So it's the systematic, gradual removal of artificial or intrusive prompts to enable control to transfer to this antecedent stimuli that are supposed to evoke the behavioral response, just all by itself. So I'm taking myself away, and these items are going to hopefully take my place. So I'm not going to, so the first prompt, the most intrusive, is verbal. You're telling them, right? You have your physical prompts, hand over hand, and then you have your verbal prompts. You're telling them, you're going to fade those out, so then you can do your positional. And then maybe your gestural, you can point. So you're slowly backing away. You're not, that's why when we do our prompts, we give them one direction verbally, and then we'll point, and then we can guide them. That's it. They don't need a lot of verbal prompts. That's just too many, because then what we're doing is we're training them to be teenagers that don't listen to their parents, and their parents are going, calling them, Sally, Sally. And they're not, they hear their name. It's like kids, mom, 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 mom. You fade it out. I don't hear it anymore. So when a student has learned to respond to a request independently, a verbal prompt such as "I'm waiting for you to ask for help" can be faded to just a pausing prompt. You're just waiting. You'll look at them. Right? They know what to do, especially like when you open something. They give it to you. Okay, thanks. Thank you. No, open, please. Okay, well then you need to say that because you know what to say. Chaining, forward, backward, and total tasks. So learning to tie your shoes, learning to wash your hands. You can either teach it from the first step on, like you would naturally do it. You can teach it from the last step and do it backwards. So like Nadine with our little guy hanging up his coat would do backward chaining with him. We want him to put his coat on the hook when he's done. We were teaching him to put the coat on the hook. We were backwards chaining with him. Rather than taking it off, how to put it on, how to zip it up, then how to take it off when he's done, and then hanging it up. We're starting with hanging it up. We're going to work backwards. Because then he's all done with the coat. Or total task, you teach the whole thing all the time. It'll go away.
Oh,
It goes away.
it's in my body.
So it's a procedure in which
Wow.
intact responses are reinforced in sequence to form more complex behaviors that ultimately occur as a single cohesive performance. An example of forward chaining to learn family-style dining skills. Jake was taught to begin with gathering eating utensils, and progressing until he has served himself and the family was ready to eat a meal together. They probably gave us that example because we all know washing your hands sequence. You gotta turn the water on first. So we teach them turn water on. And then once they do that independently, then we help them physically or visually by pointing to the picture. So our first job is turn the water on. They need to turn the water on by themselves. And then the next step that they're gonna learn is to get their hands wet. Except we're missing one picture in the sequence, which is make bubbles, scrub, because what do? They get their hands wet, they put their soap on, and then the next picture says rinse. So they put the soap on their hand, and then they rinse it off. It disgusts me. I make them make as many, I make it fun. Let's see who can get the most bubbles. Let's make lots of bubbles. Let's make a bubble party in the sink because I want your hands clean.
Right.
So we're missing a step. It's crucial. And it shows because they follow the pictures. They don't wash their hands.
How do you get around like the whole like they'll get the soap but then they'll like wipe it up off the counter?
Oh,
You have to block
the counter?
block their hands. You know they're going for it. Whoop! You don't even have to say anything. The less you talk, the better your body will love you. I'm telling you, when I was at my last job and I started at this, I was not allowed to talk all day. I had higher functioning kids, so it was a little easier, but I wasn't allowed to talk all day. I had a point. I couldn't say anything to them. I couldn't give them any verbals. I went home less tired. My throat didn't hurt as much. I wasn't as tired because your body is not using as much energy. The more you talk, more tired you're going to get. So if they're playing in those sink, you don't need to tell them no. They know that. They know that they're not supposed to be playing in the sink. Block them. Move them. Redirect them. Point. They don't need to hear you. They don't care to hear you.
There's too much noise with all those kids.
Yeah, they're screaming. They don't care. And all it's doing is background noise.
Yeah.
You're wasting your precious energy. You're going to need that energy to block.
So how do you block it? Like when like the example of the soap on the counter.
Yeah.
Do you just like move
Okay.
their hand? Because that.
So, pretend you're at the sink. Okay, so you're here, and then what are they going to do? Where's the water? Go ahead. So we're going to you're just going to,
Nope.
right? Rinse, right? And then if it's too much, then you redirect. You grab the paper towels.
See, and when I had that issue
I
with
like
my little
this.
friend in the bathroom, then he flung himself to the ground, so, you know what I mean? Then he started biting and things like that.
You ignore.
And how do you ignore and block when they're like, okay, jumping on counters?
You-
or like when
you
it comes
are-
to safety thing.
I'm not saying ignore the child. I'm saying you don't have to look at them. You can
Because
move
like
them.
in our room, that thing is so big that it's like you can't block the whole thing by yourself. So then it's like when they're like jumping
No, but
on it or
I
standing
don't know who
on
has
it.
seen me, but I will slide back and forth.
Mm-hmm.
I slide.
I go like this. Not quite like that. Sorry. One leg over.
Yeah, I spread out and then I go sliding back and forth, and I will slide. And eventually they give up because this is ridiculous. They can't get on. I'm just moving back and forth but I'm not saying anything.
Oh,
I'm
that
not
shit
looking at
gets
them
so
and I'm not
mad.
saying anything. But I'm still gonna block them.
Okay.
So you are ignoring the behavior, not the child. You are not making any vocalizations. You are not looking at them. Because you look at them, you might not think you are making any facial expressions, but if I took a picture of you, you are. You are.
Okay. Because I'm like that like makes it difficult. Like
Right.
you know what I mean? Like you can't like it's
We have
so
a hard
big.
time
It's like
with
how
that.
do you?
Right. The environment definitely has a big deal, but right now this is what we have to work with. Much easier in a smaller room. Not going to
And now
argue
like
that
if there's
point.
since there's usually more than one of us in here, like can one of us step in to block another
Absolutely.
half of it so it's not so rough? Because like I've done that.
I
I
was
mean I've gotten
thinking, why
beat
not?
up, but you
That's
know what
why
I mean? Like, I've-
you guys are in
I've
there.
stepped
You're a
in.
team.
Okay.
I can't be in there all the time.
One way.
When I'm not there,
Carefully.
when I'm in Avon, like, you guys have to figure this out. You know,
Let's do it.
problem solve together. Just don't kick each other's shoes off. Like,
We'll do like a
someone
stretch
might get a
and flex in the morning.
concussion.
Flung off so forceful.
I know. Dent in the wall.
It's the second time I've done something like that today. I went to wave at someone earlier and I threw my keys across the grocery store.
You're going,
Yeah, you gotta lift the arm up and it's like.
Yeah, I'm like, no, I was like, I don't know how I did it, but let's.
Anyway.
I have a hard time.
So we'll do a lot of practicing hopefully this week with I'm gonna have to be mean and call you out right there that you're talking too much. I'm gonna have to do it because it's just
Please do, because like I know I have that issue and like then I don't realize it, but like I have to
Yeah.
like, keep reminding myself that I talk too much.
And then you have
They-
the two of us in class.
it's a drug for them. They really get high on us getting angry and talking. You're so silly. Wait, did I read this example real quick? Hold on. Oh, shaping. Teaching new behaviors by systematically reinforcing successive approximations, so small steps towards the behavioral objective. So slight changes in form or rate of behavior are reinforced until it gradually approaches the target response. So, example, Paul needs to attend to the therapist when requested. Paul. So any attending in the direction of the therapist in response to the request, look at me, would be accepted and rewarded. After that, so once he masters that, just like in our, right, it's our task analysis, we're shaping the behavior. Once they have that little step, then you make it a little bit more of a higher criterion. So they get rewarded for eye contact and then coming up to the therapist. So here, like, our targets get harder as they master it. So they're only finding letters A, uppercase A, and then we have A and a distractor, and then we have two distractors, and then we'll do letter B with a distractor. So it increases the difficulty as time goes on.
I can't deal with you. Like she just keeps laughing and she keeps making me.
She keeps looking at you, and you just started all over.
I'll wear
hear
shoes
you
that
laughing.
tie.
Too bad a camera can't see.
I know,
Fun
that
this
was
is.
that's too bad.
Oh, you missed a session, you missed the fun. Reinforcement.
Oh.
Okay, so behavioral momentum. You guys are really good at this.
Yeah, they've
Okay.
got one going right
This
now.
one, no.
No.
It's the general relation between the resistance to change, the persistence of behavior, and the rate of reinforcement obtained in a given situation. So a student receives reinforcement, whether it's attention, escape, or the tangible item, after he or she successfully completes the easy request prior to receiving the difficult request. So you have an easy, hard. So touch your nose, touch your head, clap your hands, write your name. And before they know it, they're writing their name. Like they're already, oh, good job, we're having fun. We're gonna bounce the ball, no, roll it. And that's their goal. Right? They don't even, they're so excited that you're excited that they're doing these simple tasks, that they're gonna do the harder one that is their goal without realizing it.
It's like the giggles. It's not laughing. The kids keep playing.
Look, I'm gonna block you.
Seriously, it's a good thing you guys are separated. Behavioral contracting. I only have this currently with one child. He is high functioning. He is 9 years old. These are really for like older kids, higher functioning kids. Their goals and procedures of a behavior analysis program, mutually agreed on by the client or advocate and other involved persons, and modifiable by joint agreement. So, basically, you're saying, this is what's expected of you. If you do this, if you do it, this is your reward. If you don't, this is the consequence. It's kind of like our contracts that we sign for work. This is what is expected of you. If you do it, you get paid this amount of money. If you don't, these are the steps, the consequences. So Jake has agreed to open his mouth and allow the SLP to conduct the Beckman oral motor exercise on the intrinsic muscle 3 times a day. That is not a good behavioral contract because it doesn't show you what the reward or consequence is. A behavioral contract has what's going to happen, the reinforcer, and the consequence, and when the contract expires. Like if they, when can they revisit this? So is it going to be good for a month? And then they revisit, make a new contract. So it has to have a certain day criteria.
What does it have again?
It has the expectations.
Mm-hmm.
It has the reinforcer, the consequence, and a set time criteria. So here they have 3 times a day, which is kind of good, but for how long? And they don't have the reinforcer. Yeah, they don't have the reinforcer or the consequence in there either. Oh, my favorite. NCR. Non-contingent reinforcement. Delivery of the same reinforcement maintaining a student's problem behavior throughout the day, usually on a time-based schedule. So the reinforcement is delivered non-contingently instead of contingently. So, when a student exhibits disruptive behavior in the classroom for the function of escaping a difficult task, the teacher could implement a non-contingent fixed time schedule of reinforcement where she provides the student with escape from tasks at fixed times. So, for our kids that are they're trying to escape their work, we can say, they're not earning. It could be they've earned 3 out of their 5 tokens, and then maybe we'll take a break. We'll go for a walk. They're escaping their behavior. Or, you want to go get a drink? Okay. Maybe you can, anything that is giving them a break from their work before they're even have their whole token board. So it's giving them that, what their function is. If you know that at about 3 smiley faces, their behavior typically starts to increase because it's been too long of a time, give him a break. Doesn't have to be what he's working for, but it can be a break to go get a drink of water. It can be a go get a break to go walk around. Anything to take a break. Doesn't have to. It's not what they're working for. It's something else that they enjoy. So you're going to do that. It has usually on a time-based schedule because typically, after they get a certain 5 minutes, it starts to get a little antsy-pantsy and they want to get up and they want to do something, they want to get out of the situation. So that's why it's usually on a time-based schedule. Okay. Pre-MAC principle. Access to high probability behavior is made contingent on performance of low probability behavior. So this is our first then. When I think of this, this is how probably most of us were raised. First eat your dinner, then you can have dessert. First do your homework, then you can play. So a 12-year-old student with ASD and low cognitive functioning continually requests to play Angry Birds on an iPad. So access to their favorite game is contingent on completing a modified academic task, like identifying coins. When you finish the naming the coins, then you can play Angry Birds. First name coins, then Angry Birds. So first then. His pre-MAC principle, do you have that? Okay.
Yeah, I'm good.
Let's see if it's a video. It's not, I don't know what to say.
Is that an extinction burst?
So your extinction burst, the
That's what it
behavior
looks
will
like.
get worse before it gets better. They will fight you and fight you hard.
This is Sam. Whenever Sam wanted a cookie, he would always ask his mom. Then Sam would get a cookie. But one day, Sam wanted a cookie, so he asked his mom. But all he got was a no. No matter how hard Sam begged and pleaded, she would just say no. So Sam does not have a cookie. This continues for a week, and Sam eventually stops asking his mom for a cookie. So what happened? Extinction happened. Extinction is a basic principle of behavior. The behavioral definition of extinction is as follows. A behavior that has been previously reinforced no longer results in the reinforcing consequence, and therefore the behavior stops occurring in the future. So in Sam's case, the behavior of asking his mom for a cookie was no longer reinforced with the cookie, so he stopped asking his mom for a cookie. Often, during extinction, there is a brief increase in frequency, duration, or intensity of the behavior before it decreases and ultimately stops. This is known as an extinction burst. For example, when Sam's mom does not give the cookie to him, his begging and pleading increases for a brief period of time. One other characteristic of extinction is that the behavior may occur again even after it has not occurred for some time. This is what we call spontaneous recovery. Although Sam may have stopped his cookie asking, he would ask once in a while just to see if his mom would give him one. If Sam's mom were to give him a cookie at that moment, the behavior of cookie asking will increase in the future and would no longer be considered extinction. This reinforcing action produces resistance to extinction, which basically means it makes it harder and longer to extinguish the target behavior. On a final note, a common misconception is that extinction simply means to ignore the behavior. So if Sam were stealing cookies and his mom ignored his behavior, would his behavior of stealing decrease? I don't think so. So extinction isn't just ignoring the behavior, it means to remove the reinforcer of the behavior. In Sam's cookie asking case, the reinforcer of that behavior was his mom giving him a cookie. Since the cookie reinforcer was removed, Sam stopped asking his mom. So in the end, when Sam wants a cookie, he asks his dad.
Okay.
Oh my.
Alrighty, so, you have your spontaneous recovery. I think we got everything. So it's
Why does that happen?
because it's like their brain goes, wait a second, this used to work. Let's try it again.
Right. Well, that I get, but like, yeah, I don't know where I'm going with that.
Because,
It's just-
and then if there's that one person,
Dad?
that
It's like,
lets
oh,
it
yeah.
happen,
It's-
now you're starting from like negative below zero. Like you're not even at ground zero anymore. You're not even starting over
Sorry.
because now the behaviors are going to escalate because they realize that it won and they just have to push a little bit harder this time.
Mm-hmm.
So it makes
Their
it
face,
worse.
Like another puppy dog face.
It's just awful. That's when you start getting more aggressions because it worked before.
Yeah.
Maybe if I do it harder.
I'm going to try harder and I'm going to try longer and I'm going to wait and wait and wait and wait because eventually he's going to crack. Eventually, I just have to wait. So it's why it's so important when that spontaneous recovery comes back, and it will. You have to keep your ground because otherwise you're doomed. Okay. Extinction practices. Admitting the target behavior does not enable the person to escape the aversive stimulus. So a child cries and refuses to eat a non-preferred food item, and staff points to preferred food item and wait for the child to eat non-preferred item before they eat the preferred. So you have to do this. You have to eat your peas before you get your donut, whatever. So, and they're just pointing, right? Because they don't need to say anything. They're just pointing. Like, look, donut's waiting. Eat your peas, donut's
That's like with
waiting.
the one little. It's like with art.
Mm-hmm.
Her meat before she can have her treat.
Right. You have to eat the
Or
non-preferred before you get your preferred.
I have seen that.
So it does your escape. It's not going to enable them to escape that awful, those yucky peas. I like peas, but I'm just
I
saying.
like these. Yeah.
Okay, so
I like donuts better.
extinction practices, sensory extinction. I'm also tired. The process by which behaviors maintained by automatic reinforcement are placed on extinction by masking or removing this sensory consequence. It involves elimination or attenuation of stimulation produced by behavior while still permitting responding to occur.
That's a long sentence.
This is really, I'll read the example. Maybe this will explain it a little better. So if a person wiggles their fingers in front of their eyes for visual, right, we see this. Yee, yee. And a barrier is placed between their eyes and their hand. So you go yee, and then I put it's going to block that sensory. They can still move their fingers, but they're not getting that sensory stimulation because they can't see it.
So odd.
If they are headbangers, right? They want to headbutt you or headbutt the wall or headbutt the bench or whatever. You put a helmet on, you can still do it, but they're not going to get the same sensory feeling. Another one is, those are the two best examples that I could think of. We'll move on.
I want to see some more, you modeling some more of that.
I'm really good at
behavior.
stimming. What does punishment look like? So we're done with the reinforcer part. So the punishment, which is our last resort. We're not going to use punishment here unless we have tried every other reinforcer possibility. Punishment is no bueno. It's a presentation of something undesired. So we're going to give them something that you don't want, they don't like. So it is that's positive punishment. That's why you can't think of positive as something good. The punishment is the behavior. We'll go down. Or the removal of something desired. Which is negative punishment. So, they are supposed to go to a water park, right? And then they are bad, and now they no longer can go to the water park. That's a punishment. It's an attempt to reduce the behavior. That's a good word, attempt. Okay, so here are some examples. Social disapproval, alerting an individual to a problem with their behavior through verbal corrections, reprimands, or through facial expressions. Keep your comments to yourself when we're doing these punishment things because I don't need anybody's names. If you think of examples, good, but don't say anything. Example, parent shakes their head no and provides a tissue and Jason puts his finger in his nose. Please don't say no. Don't say don't say stop. Those are punishment techniques.
Those are like all the words that I say that I catch myself.
You just told on yourself for one of them. You're aware of it though now.
Yeah.
Now, you're still going to do it because it's going to take time for you to break that
Yeah,
habit,
I catch
but
myself
you're
and I'm
aware
like,
of it. You're aware of it. And that's step one, aware. What's that? Step one.
There's denial, depression.
No, it's the first one. When you go to like AA, you
you admit that you
Admit it.
have a problem.
you just admitted it. So whatever.
Oh, so I've completed step one.
Yes.
There's like
12.
11 more to go.
Let's go to
So, you know, don't get too excited.
Punishment practices. Response, interrupting, or blocking. So if they're playing in the water at the sink, right? We've already given them all their positive. We've shown them how to wash their hands appropriately. We have given them gesturals and visuals. We've given them pictures on what they're supposed to do to wash their hands. There's not a picture of playing in the water on the counter. We point to the right? We're giving them all the reinforcers possible, but as soon as they start playing in the sink, Now we're going to make sure that they can't complete that behavior. So physically blocking the occurrence of dangerous behavior, such as self-injury and physical aggression, typically using a soft item or a person's hand. So I'm going to block. I'm not going to let a 4-year-old hurt me. It hurts. I don't care how little they are. It still hurts. You can still get hurt. You can still hurt your nose. You can still get poked in the eye. It still hurts. Just because they're 4 or 3 doesn't mean it doesn't hurt. I get it. But we're going to use our body or a beanbag or a blanket or something to block ourselves. It's not self-defense. We are just blocking. It's it. So the example, when Michael is not engaging in preferred activities, he frequently bangs his head on a nearby wall. We have these kids. Caregivers are taught to place a soft cushion between his head and the wall. When he stops for 3 seconds, verbally redirect him to use his communication system to express his wants or needs. 3 seconds is not long enough for our kids at all. We put that sensory thing, we can gesture, we can point to a hamper to sit in or a beanbag or something. Let's give it like 15 seconds before we verbally say anything to that child, because our kids are so attention seeking that might just spiral it out of control. So don't wait 3 seconds. That's too short. Punishment practices, non-exclusionary and exclusionary timeouts. There's 2 different kinds of timeout. It's the contingent withdrawal of the opportunity to earn positive reinforcement or the loss of access to positive reinforcers. So they cannot even earn cars. Can't even earn Brown Dragon. They can't. You can't even earn it. Sorry. Not even going there. You don't even bother for a specified time. It's a form of negative punishment because we are taking it away. So, asking an individual to go to their room following inappropriate behavior for private time, downtime, alone time, or rest time. You're preventing the individual from engaging in activities following inappropriate behavior. I wonder if at the end I'll ask.
Asking
I have my questions, but I'll just wait. See if it goes through first.
Access.
Some of you might know from the first time we did this. Okay, punishment practices. So you have a response cost. So contingent upon a target behavior. So if they clear the table, they don't want to work, they throw everything on the floor. The person loses something of value they have previously earned or is normally given. So let's say they already earned 3 smiley faces. They clear the table, we're going to erase a smiley face. They've already earned it, and now we're going to take it away. So loss of 1 of 10 tokens after an individual shouted at a staff member. They've already earned it. If anybody goes into my bank account to take money because I was late on typing a report, I would lose my mind. I would never want to report again. Because you're taking something you've already earned. You can't take it away.
So you're saying don't do that?
No. Don't really do any of these punishment practices unless you've already talked to me about them. Because there's probably a reason why we're not doing it.
Are you allowed to, like, I don't want to use the word threaten because you're not threatening them, but are you allowed to, like, say that to them, like, but not really do it, or is that kind of like the same thing? Okay.
No.
Okay.
It's a threat. It's a threat.
And then you don't follow through with it, right? So then it teaches them that it doesn't matter.
Your words mean nothing.
Okay.
Mean nothing. Means nothing.
Mm-hmm.
Overcorrection, positive practice. So, contingent on an occurrence of the target behavior, the learner is required to repeat a correct form of behavior or a behavior incompatible with the problem behavior a specified number of times. So, a person throws a cup, breaks it, and the staff respond by repeatedly asking them to pick it up and place it down gently. Pick it up, put it on the table. And then the teacher puts it back down on the floor. Pick it up, put it on the table. You're going to practice it over and over. It's not that the child doesn't know that the cup goes on the table, they threw it on the floor. So you can have them pick it up one time because they threw it on the floor, but you don't need to have them continuously practice it. They get it. They know they're not supposed to do it. Now you're just giving them attention. Have them, for sure, have them pick up the cup that they threw on the floor. Absolutely, but they don't need to do it 5 times. Yes,
That's
people are out there that do that.
I can think of some people from our old place.
Yeah. Awful.
Yeah, it's a little doing. That's doing too much.
Do it again.
Do it again. And again. You ran in the hall. Let's try it again. And again. And again. There are also, the overcorrection is they messed up the room. Not only do they have to clean up the part that they messed up, they have to do more. They have to spray the tables and vacuum.
Yeah, they didn't do that. Sounds good.
Mechanical restraint, obviously we don't have to worry about that here. The use of straps, harnesses, and boards to prevent a person from moving. Like a
Like strap
ambulance.
them down.
Oh my gosh.
When a person wears a harness when walking with others because they might wander off.
Like the kids with the backpack with the
Hey, my
The
mom did
kitty
that. My
leashes?
mom did that with my brothers, but because there was 2 of them, and when she'd take them to like
Yeah,
twin
they're
days or
wandering
whatever,
around.
she definitely did
It's
that.
different when you're a parent, right? But
But us,
there's no reason for it. We're one-on-one, especially.
twin brothers.
We don't take them on field trips like for their purpose. Like you might wander off. Protective
Yeah.
equipment, so providing a tangible item to a person or their environment that prevents them from injuring themselves. So placing a helmet on a person who has a history of banging their head. Placing a barrier on a person's bed so they don't fall out. So we have protective equipment, but we use those as our last resort. There is a reason, like yes, we might want them to have a monkey leash. But there's a reason for it, and that's because they've already tried all of the other reinforcers, and it didn't work. So now we have to step up our game to keep them safe.
Or like, would that be one if like they ran out of the building? Like then like, you know what I mean, like something like that, or.
Yeah, but you would still look. Yeah, but you'd have to really look at your environment, like the building. Like, okay,
How did they get out of the building?
for AR, she has to carry a box because before that box, I don't know. It's been almost a month that she's had that. We couldn't get in from ESAP to this side of the building without a full-blown tantrum in the middle of the waiting room.
Yeah.
Every day it
I
became
remember that.
such a problem. So you can't you get to pick your price. You get it on the other side if you have safe behavior, and you can't really. You're not going to run and flop on the floor if you're holding something,
Right.
right? It's an incompatible behavior. So that's why I gave her her bin. She has 4 very highly preferred, and those are only for transitions. That's it, because that behavior was so unsafe and disruptive to every single person in the building, especially like Carl and Renee and people waiting in the waiting room and seeing this. It was just, and then one day, Mom came to have a meeting with me and saw it. And it's just like, it looks like we don't know what we're doing. And just, you know, it's not okay. We have to make sure we have control of our kids. Boop, boop, boop.
Yeah, it probably looks like that other people in the waiting room too. Like
Right.
that's
I'm
what
not
they
sending
do.
my kid here.
Right.
Right? But that's when I really just started working with her. And so I had to assess the situation before I could give her a behavior plan. Crisis emergency procedures for high intensity target behaviors. Okay, so this is the last one, and then the good part is the next session is only 19 pages, so we'll still make it out on time.
The following excerpt is from CPI's Preventive Techniques 2 DVD, featuring strategies and content from CPI's Nonviolent Crisis Intervention Training. This clip is intended to help staff recognize anxiety in clients, patients, or students and respond appropriately to it. Anxiety is demonstrated by a change in a person's behavior. Think for a moment about the people you work with. How do you know when they're anxious? Your responses might have included fidgeting, pacing, rocking, or hand-wringing. Some people withdraw, others become very talkative. The better you know the people in your care, the more easily you'll be able to identify the way that they behave when they are anxious. Anxiety calls for a supportive response. In order to provide a more supportive staff response, it's helpful to know the person's typical behavior and to know what's important to the individual. Let's see how that might look.
This is just the worst thing that could have happened. I can't believe it. What did I do to deserve this? I'm such an idiot.
I can hardly keep up with what you're saying, Chloe. Something must really be bothering you. Want to talk about it?
Stella always helps me. She's one of the few staff here who understands my issues. Some of the other staff just don't listen. All they want to do is boss me around. I know, they're in charge. I wish they had more Stellas here.
Hey, Anthony, want to give me a hand here? I could use the help. Come on. Sometimes I can distract Anthony. When I take the time to really get to know the client, then I can figure out what's really bothering them. Anthony's not a bad guy. He's just had some tough breaks.
I'm sorry we're taking so long today. We had an emergency earlier. It shouldn't be much longer.
I guess I can wait a little longer. We usually have to wait in this place. I'll give them another 10 minutes. If I'm not called in by then, they're really gonna get a piece of my mind.
Oh my God! What am I going to do? What am I going to do?
I know it's been a rough day, Chloe. I'm here to help in any way I can. I know I can't do that with all clients, but Chloe usually responds well when I give her a supportive touch on the arm.
As you can see from these examples, there are many different ways of being supportive, but there is one common component in many of them, and that is that staff members are keenly aware of their own nonverbal behavior. First, let's take a look at personal space, also referred to as proxemics. Most of us feel uncomfortable when somebody gets too close, but the amount of personal space we need varies from person to person and situation to situation. What's true for almost everyone is that coming too close tends to increase a person's level of anxiety. It might even be perceived as a threat. Respecting an individual's need for personal space might make the difference between a person listening to you or moving into that second defensive behavior level. Maybe you noticed that in one example, the staff person touched the agitated individual. Sometimes appropriate touch can have a calming, comforting effect, but it's a supportive response that should be limited to situations in which you have a strong rapport with the agitated person and are confident that your touch will be received in a positive way. Notice, too, that sometimes you don't need to say anything. Silence can be a good thing. You just need to take time to listen, without comment and without passing judgment. Think about your own experiences. What supportive responses work best with those in your charge?
Let's take another look at the staff members who showed us their supportive responses. You'll notice that in addition to allowing space of about one leg length if standing, these staff members avoided a toe-to-toe challenging position. Instead, they stood off to the side. This position is called a supportive stance. A supportive stance reduces the chances that you'll be seen as a threat and also allows you a margin of safety if the other person becomes physically aggressive. Notice that even the staff member who touched her client on the arm approached from the side and avoided quick movements that could be seen as threatening. There's another form of nonverbal behavior that's also important throughout all the crisis development levels. Most of us call it body language, but the more technical term is kinesics. Kinesics includes posture, movement, gestures, and facial expressions. It's important to be aware of your own body language and try not to do things that may appear threatening, such as putting your hands on your hips, rolling your eyes, or shaking your finger. Facial expressions can also communicate anger, disgust, or other emotions that can raise anxiety levels.